A little later on, we're going to have questions from the group, but I want to raise a few questions with you as well, in a couple of different areas. I want to piggyback on this issue of integrated health in the sense of the Michigan system, where you have a way to connect with one another. Dr. Ryan, you are outside of the Michigan system. You are at Packard. Now, if you have a patient who presents to you with symptoms of some sort of whether it's depression, whether it's a mood disorder, can you contact the University of Michigan? Do you have a way in to find out the health background of this person, to find out what medications they will be taking, or are you flying blind?
So we have the ability to access both St. Joe's and UofM computerized records. So that has gotten a lot better over the last 15 years. So we're not in, the electronic equivalent of the dark ages. So a lot of the electronic barriers have gotten better. So what we've done at Packard is we've actually worked with CSTS and have had a MSW, a full-time MSW actually on site. And actually Dr. Florence has worked with us for around 9 years now, a half day a week. So we've got in our office a full-time MSW and a half a day of a psychiatrist. So we tend to use for quick backup, rather than the cell phone, we walk upstairs and talk to the social worker. So that was how, a lot of, and so the term for that within is they call it co-location, right? You're together. But what you really need is you need sort of integrated conversation and the ability to work together and understand one another. And then like all human relationships, they go better if you know one another and you have an established relationship, and there's some time and trust there, because it's different than the standard model everyone's trained in. That like a lot of things builds over time as people become comfortable with one another.
Okay, then I want to ask Danielle and Phil, given that you're affiliated with the University of Michigan system, how does it work when you interact with docs from St. Joe, or when you end up with a patient that has spent most of their time in the St. Joe system? Is there a connect there? Danielle?
Well, being a social worker, yes. I mean, the electronic medical record is still, I think, a work in progress. Coming from the background in Minnesota, I know that there is a feature that will be coming that is called Care Everywhere, which is once a patient's release their records into Care Everywhere, anyone who's in that electronic system can access them, which is really a lovely feature of the electronic medical record. So that's coming, but for me as a social worker, the common denominator in everything is the patient, and so if I can access the patient, I can get most of the information. I would prefer most of my information to come from them if we can make that happen, or their family members, because that's really, they're the constant in all of this. But then, obviously, then it's the co-location, or that consultative relationship where you pick up the phone and you fax over releases and you try and get a hold of somebody who you can talk to about what's going on and what the plan should be.
Phil, what's your experience been?
There's an agreement between UofM and St. Joe's to share the medical record in terms of everything gets faxed and scanned within 24 to 48 hours. So it's there, you just have to know how to find it. The problem for me is not that, it's when they get admitted to Brighton Hospital for substance abuse, or they get admitted to someplace else and they come back, I have no idea what's going on.
Right.